Hello friends, I decided to make this recording to share with you the significance of the findings of one particular research study. In fact, if we read just the title of this lecture, low vitamin B12 and hyperhomocysteinemia are risk factors for brain atrophy, cognitive decline, and dementia. Now, I don't know of a person who would like his or her brain to atrophy or have cognitive decline or develop dementia, specifically Alzheimer's. And so I hope you will agree with me that this lecture has a very significant practical application. Before I move on, I'm sure you've heard of vitamin B12. You may not have heard of hyperhomocysteinemia. Homocysteine is a type of amino acid. It is not an amino acid that we actually ingest with food, but it is one that is made in our body. Hyper means elevated or too high, higher than normal. Emia means in the blood. So this word, hyperhomocysteinemia, is referring to a specific compound known as homocysteine, specifically high amounts of this compound found in the blood. And before I get into the study, I have a few slides of introduction. Number one, it is normal for brain to atrophy as we age, to a degree, okay? So there is a modest rate of brain atrophy. However, individuals who develop mild cognitive impairment, that's what this stands for, MCI, mild cognitive impairment, have faster rate of brain atrophy in comparison to just normal rate of atrophy. And then individuals with mild cognitive impairment who eventually develop dementia or Alzheimer's disease is one specific type of disease in a broader category of diseases we call dementia. These individuals still have faster rate of brain atrophy. And so if there is anything that speeds up the rate of atrophy, or if there is anything that can actually slow it down, it will be significant to prevent mild cognitive impairment or more severe form of cognitive impairment, dementia, and or Alzheimer's. Now, just to make sure that you know what I'm referring to, I included here three different definitions of atrophy, okay, of body tissue or an organ. Atrophy means waste away, typically due to the degeneration of cells. Another definition, gradually decline. It should probably be gradual, but I just copied it the way it was on the website that I found this definition from. So gradual decline in effectiveness of vigor due to underuse or neglect. And here is specifically definition referring to brain atrophy, cerebral, that's referring to brain. Cerebral atrophy is a common feature of many of the diseases that affect the brain. Atrophy of any issue means, or any tissue rather, means a decrement in the size of the cell, which can be due to progressive loss of cytoplasmic proteins. Cytoplasm is part of the cell structure. Okay? In brain tissue, atrophy describes a loss of neurons and the connections between them. Of course, as we lose these neurons and the connections, then our brain cannot function as well as it used to do. Also, since I will be referring to homocysteine, and I already have in the title, as I mentioned, homocysteine is made in the body, is derived from methionine, which is an amino acid that we ingest from foods, mainly meats and foods of plant origin, but it is also found in legumes such as soybean, for example, and even in grains as well. And so from this amino acid methionine we get homocysteine, which then can be degraded with the presence of vitamin B6 into other compounds, or converted back to methionine if we have adequate amounts of folate, which is another term for folic acid, which is a B vitamin, and vitamin B12. Now, I am focusing, or will be focusing in this lecture somewhat on vitamin B12. This is because we know that in populations with relatively high folate intake, vitamin B12 is the determinant or the major determinant of homocysteine status. Okay? In the United States, as in some other countries, the government mandated that folic acid is added to the flour, and so we have a relatively high intake in comparison to people who may live in countries where fortification did not yet take place. So B12 would be likely more important in the United States and other countries in which fortification of folic acid took place. With that introduction, here's the study I was referring to. Homocysteine lowering by B vitamins slows the rate of accelerated brain atrophy in mild cognitive impairment. And this was a randomized control study. So in this particular study, the researchers included 271 individuals. They were over 70 years, and they had mild cognitive impairment. They divided them into two groups. Group 1 received supplements of folic acid, vitamin B12, and vitamin B6. Okay? Group 2 received placebo, which basically means sugar pill. Okay? There was not an active agent that would make any difference in their well-being. The treatment was conducted for 2 years, 24 months. Now, I will not go into all the details of the findings, but I will share with you, because these researchers included, in addition to describing the changes in these both groups, received two cases, or included two cases. Case A here shows a picture of the brain, okay, of a female participant in the placebo group who was 79 years of age. Her homocysteine, THCY, that means total homocysteine, was 22 micromoles per liter in the beginning of the study, and it increased by 8 micromoles per liter over a 2-year period. Brain atrophy rate in this particular individual was 2.5% per year. And we see the atrophy in the bright colors. So any of the blue or the light blue or darker blue, or here kind of yellowish or pink, this represents atrophy of her brain. On the other hand, we have case B. Case B was a female from the treatment group. This is the group that received the supplements of folic acid, vitamin B12 and vitamin B6. She was 72 years old. Her homocysteine at baseline, or at the beginning of the study, was 24 micromoles per liter. Notice that it was almost identical, almost the same as homocysteine in the first patient here. But in the course of the study, her homocysteine actually was slashed by half. Notice it increased, or rather it decreased, I should say, from 24 to 12, so it decreased by 12 units. the atrophy rate of this individual was 0.46% per year. And the conclusion here is there is no clear visible pattern of atrophy. We see barely few spots here and there. Notice the brain atrophy rate was 2.5% in this individual, the first individual, 0.46 in the other one. The conclusion? The rate of atrophy was more than 5 times slower in the participant taking B vitamins than in the subject taking placebo. Okay? Now, here I have some details in regard to the placebo group and in regard to the active treatment group. Number one, when we look at vitamin B12 before the experiment or at baseline or in the beginning of the study, it was almost identical, 333 picomoles per liter. In the placebo group, 330 in the active treatment group. If we look at B12 level after the treatment or at 2 years period of time, it actually increased slightly in the placebo group, 366, but it more than doubled in the active treatment group. Now, when we look at holotranscobalamin is actually even more reliable marker of vitamin B12 status in comparison to serum vitamin B12. And so again, we have 68 in the beginning of the study, 63 in the other group, almost identical. And then it increased slightly, notice, after the treatment or at the 2 year interval, 73, but here almost tripled, 182. Now, the important thing to keep in mind is that oftentimes in research studies and in clinical practice, even if the physicians check for holotranscobalamin, which is almost never, but even if they do, they would take a value of less than 35 as inadequate or as deficient. Here we have 68 in the placebo, 63 in the active treatment, which again clinicians would call normal. Okay? Also, when we go back to serum vitamin B12, a value of 148 or lower than 148 is considered abnormal. So this value here in the placebo is more than double, is about 2.5 times almost that of what is considered in clinical practice inadequate. Furthermore, when we look at homocysteine, notice in the placebo group it was 11.27, almost identical to the active treatment, 11.28. Okay, these are geometric means. And then after the treatment it was 12.14, 8.72, so there was actually about almost 3 units decrease in the active treatment and slight increase in the placebo. But even this slight increase would not be something that a clinician or a physician would call hyperhomocysteinemia or elevated homocysteine level. In fact, just this past week, I participated in a conference or a panel of neurologists, and one of the neurologists, practicing physician, presented data published in New England Journal of Medicine, which is a journal with the highest impact factor. Impact factor is sort of a rate of a particular journal. It's one of the highest, if not the highest ranked journal in the world, medical journal, okay, in which homocysteine level above 21 was considered too high. This is a quote from another publication that actually adequately describes what we saw in the findings of the study that I am sharing with you. Notice what it says. Moderately elevated concentrations of total homocysteine have been associated with an increased risk of dementia, notably Alzheimer's disease, in many cross-sectional and prospective studies. Notice the wording, moderately elevated. It doesn't have to be very high to make an impact on dementia and or Alzheimer's disease according to this particular study or this particular quote. Now back to the manuscript, the initial manuscript that I had the data from. Notice rate of atrophy was significantly associated with the change in total homocysteine and inversely with change of holotranscobalamin and transcobalamin saturation, which again transcobalamin is a marker for vitamin B12 status. Furthermore, when we confined the analysis to the biologically compliant subjects, the effects became stronger and change in folate and vitamin B12 also became significant. Thus, the greater the improvement in folate or vitamin B12 status, the slower was the rate of atrophy. Those subjects whose folate or vitamin B12 status declined were at increased risk of atrophy. Okay? And so it's very important to remember that the initial vitamin B12 level of 300 something was inadequate. Okay? You know, the difference was seen among patients that vitamin B12 was increased, and as vitamin B12 and or folate were decreasing, then they saw a higher rate of brain atrophy. That's basically what they are saying here. Now, I don't typically recommend to use folic acid supplements, simply because there are some studies that show they actually might slightly increase risk of some cancers. But folate, nevertheless, is very important in our diet. And so I included here data on some good sources of folate. And I want you to notice a pattern here. Soya bean, garbanzo beans, white beans, lentils, which are beans, split peas, which are beans. Okay? And so beans are very good sources of folic acid or folate. Okay? Asparagus, spinach, what are these? Brussels sprouts. These are all leafy vegetable type of thing, right? Leafy vegetable. And so leafy vegetables are also good sources. Avocado. Notice 100 micrograms per half a cup here in avocado. I have an avocado every single day basically, with very few or very rare exceptions. And it would be a good idea to include a variety of these in our diet. Also, as we age, we lose the ability of absorbing vitamin B12. And so vitamin B12 supplements are recommended for people 50 years and over. Okay? Now, older people are not the only ones who need supplements. Vegetarians need supplements. There are other groups. But since I'm recording this in the context of cognitive decline and dementia and brain atrophy, I'm focusing on this population. Okay? The dose of supplements of B12 depends on age. So if you are 50 to say 70, 250 micrograms per day of vitamin B12 will likely be sufficient. If you are older than that, I would recommend 500 micrograms. And this is not my guess. And there is sufficient data in the literature to support these recommendations. I just don't want to prolong this recording, but I could show you, in fact, in some other recordings I have that data. Now, for more information, I hope you will get one of my books, the latest one, Vitamin B12, Combating the Epidemic of Deficiency. Or I also deal with B12 and homocysteine in some other books, including Forever Young, Secrets of Delaying Aging and Living Disease-Free. If you have, or if you would like to get my books on vegetarianism, I also have information on these vitamins and all. If you would like more information or how to obtain the books, you can email me at the address listed there. Thank you.